So if you do see that, you know, there's issues with the single leg squat in terms of the hip stability, the knees going in, things to watch out for, to wait on until you've got them strong and showing that stability would be lower leg, lower body plyometrics, you know, box drops, a lot of cutting, agility stuff. I'd wait on until you saw that they're really, really stable with that test. Is there anyone here with a history of ankle sprains or ankle issues by chance? Come on up, if you don't mind. Okay, so I just want you to face everybody, and with your legs apart a little bit, however you would do a squat, keeping your heels on the ground. Go ahead and just do a squat for us. Okay. Okay. Yeah. So, and come on back up. With this, what you're going to look from all sides. You're looking from the back, the side, and the front. With the front, you're again looking for, are the knees dropping in? But from the back and the front, you look, are they loading each side equally? Are they overloading one side versus the other? So go ahead and do another squat for us. Okay. And so this is pretty classic. So what she did there, and I could immediately tell it was her left ankle before she said anything, because when she drops down, she gets to a point where she can't go further with her knee because she doesn't have enough dorsiflexion in her ankle. But this knee can go further. So what happens is this, it's a rotation. So I've had a lot of patients in the past with say a right hip, right knee, right ankle, or some kind of back issue. And the thing that led to it was the fact that they sprained their ankle 2 years ago, and they've been doing squats like this, right? So they're just loading that side, right? So you want to look from the front and back. Are they loading evenly, first of all? If they're shifting, are they immediately shifting? Like it's some kind of a neuro pattern, or you know, are they just got in the habit of staying off one side versus the other? Are they real nice and symmetrical till they get low and then they tilt off? That's usually going to be more of a hip or ankle range of motion issue. Okay, if both ankles are limited, what you'll see is they get to there, they can't go further, so to get deeper, well, she was smart and she just stopped. But you know, like I see a lot of high school athletes in the clinic, and it amazes me that they're told to do box squats, you know, touch the box down here, but they have no dorsiflexion. They're like stuck there. So what they do is, what happens, they can either fall backwards or they have to lean forward with this big load on their back, and then they strain their back. So kind of the consequences of ankle issues on one side is that you'll usually overload the opposite side. And then if they're both tight, you'll usually bend forward too much. And then the back's at risk. To look at each of them individually, I have them do knee drives. Put your hands here, put one foot forward. Let's do the right foot first, and this foot back. Okay? And you're just gonna drive this knee forward over your toes as far as you can. No, keep the heel down. Don't worry about this, we're just looking at the right. Okay, so as far as you can, keeping the heel down. Now what keeps you from going any further is okay, so let this heel come up, that's okay. We're looking at the right side. Okay, so go as far as you can. Tell me what stops you. Is it a pull back here, a binding in the front?
Pretty much my right gastroc and
okay.
Achilles tendon.
Good. Come on out of that. So that's good. On her right side, she's good. What you want to feel at that end range is that, or what you want them to feel is that they have a stretch here somewhere along in the gastroc soleus or down in the Achilles, right? If they're having a binding in the front, that's a problem, and it needs to be fixed. And manual therapy, those who know how to do it can fix that really quickly. Go ahead and try that on your left now. Just drive that knee forward. Yeah, that's fine, yeah. Okay, so come back. No, keep that heel down. Okay, what keeps you from going further forward there? So she, surprising to me, doesn't have that block feeling in the front, even though she's really limited. What I would do with her is probably work on the posterior side of her leg, loosen that up, and then the next time she did it, she probably would get the block feeling, because that's more of a scar tissue thing that can build up from, especially with ankle sprains. Thank you so much, appreciate it. So again, with the squat, you're looking at it from all sides. Are they loading evenly? Is there an issue like a pinching at the hip or a block at the ankle that is causing them, or maybe a knee pain or whatever? You know, what you have to kind of communicate with them. Why aren't you loading symmetrically? Try to get to the bottom of that. You know, if it's something like the ankle stuff, you know, just stretching a tight ankle, if it's a joint thing, it's probably just going to grind the ankle. It needs to be released with some stuff, some techniques. But if it's just a stretch in the back, foam rolling, stretching, things like that should knock it out. You just kind of incorporate that into your programs.